Bismillahirrahmanirrahim. I'm Fuad Ali, Assistant Professor, Department of Pharmacy, Quad University of Science and Technology. Welcome to the course Pharmacology and Therapeutic 2A. Today, the topic of our discussion is anti-epileptic drug. Outlines. We will discuss the following outlines one by one, like the basic mechanism underlying the seizures and epilepsy mechanism of action, anti-epileptic drug classification, side effects, targets. After watching and listening, student will know about the seizure types, general side effects, and target of anti-epileptic drugs. Basic mechanism underlying the seizures and epilepsy. Seizures, what is seizure? The clinical manifestation of an abnormal and excessive excitation and synchronization of a population of cortical neurons. Epilepsy is a disease characterized by a spontaneous recurrent seizure. So when the seizures are recurrent, they are spontaneous recurrent, then this is known as the epilepsy. Epileptogenesis, a sequence of events that convert a normal neuronal network into an epileptic neural network. This is known as when the sequence of events basically that convert a normal neuronal network into a epileptic network. So seizures are classified into partial and generalized seizure. So they are partial, like this is a conscious state, like they are the simple and complex, and generalized. The consciousness level is lost. So tonic-clonic, absence, myoclonic, febrile, and status epilepticus. So partial seizure. Partial seizure is simple and complex, and secondary generalized. So simple partial seizure. It's focal with a minimum spread of abnormal discharge. They are focus. Focal normal consciousness level and awareness are maintained. Sorry. Complex partial. In complex partial, location onset, local onset then spread. Impaired consciousness level. Clinical manifestation vary with the site of origin and degree of spread, like automism, another motor activity. Temporal lobe epilepsy, most common. Temporal lobe epilepsy is most common. Secondarily generalized seizure, like begin focally with or without focal neurological symptoms. Variable symmetry, intensity, and duration of tonic, stiffing, and clonic jerking phases. Typically, duration up to 1 to 2 minutes. So, seizure is classified as a generalized, seizure is classified as generalized and partial seizure. In partial seizure, we discussed there are two types: simple and partial and complex partial. In sub, in simple partial seizure, the conscious level is maintained, while in the complex partial seizure, the conscious level is lost. Whereas in the second type is generalized seizure. In generalized seizure, both hemispheres are widely involved from outside. Manifestation of the seizures are determined by the cortical site at which the seizure arises. Present in 40% of all epileptic syndromes. Generalized seizure, absence seizure, petit mal seizure. Like this is a type of the generalized seizure, like this is known as the absence seizure or petit mal seizure. This is when there is a sudden onset and abrupt cessation, like brief duration, consciousness is altered. Attack may be associated with mild clonic jerking of the eyelids or the extremities. Posture tone changes, difficult diagnosis from the partial. Characteristic 2.5 to 3.5 Hg spike and wave patterns. So in generalized patent mark seizure, there is a sudden onset, abrupt cessation, and then there is a brief duration of consciousness level. Attack may be associated with the mild cloning jerking of the eyelids or extremities. There is also difficult to characterize or isolate in the diagnosis from the partial seizure. Myoclonic seizure. It's a myoclonic jerking is seen in a wide variety of seizures, but when this is a major seizure type, it is treated differently to some extent from the partial leading to the generalized. So in this myoclonic jerking is seen in a variety of seizures. Atonic seizure, sudden loss of posture tone, most often in children but may be seen in adults. Sudden loss of the posture tone, they may be most commonly they are often present in the children but may be seen in adults. Tonic-clonic seizure, also known as grand mal seizures, major convulsions with rigidity, tonic, and jerking, clonic. This slows over 60 to 120 seconds, followed by the stopper state, post-actal depression. Like this is a major convulsions with the majority of the tonic and jerking clonic. Like this is the tonic phase, stuffing. And this is the clonic phase when there is jerking. Recruitment of neurons through the cortex, major conversion usually with two phases. Tonic phase muscle will suddenly tense up, causing the person to fall to the ground if they are standing. So the tonic phase muscles will suddenly tense up, causing the person to fall to the ground if they are standing. Clonic phase muscle will start to contract. This is the muscle will start to contract, like this is the case of the clonic, and the muscle will start to contract. When the tonic plays, muscle will suddenly tense up, stiff, causing the person to fall to the ground if they are standing, and relax rapidly in case of the clonic, causing convulsions. What is convulsion? It is a motor manifestation. May or may not be present during the seizures. Yes, this is because it is not necessary to be present during the season. Excessive neural discharge. In the case of the convulsion, there should be an excessive neural discharge. Convulsion appear in simple partial and complex partial if the focal discharge include motor centers. They occur in all generalized tonic-clonic regardless of their site. Well, they are present in all generalized tonic-clonic seizure regardless of the site of origin. But in the case of the simple and complex partial seizure, if the convulsion will appear if the focal discharge include the motor centers. Atonic and absent seizures are non-convulsive. They don't have any convulsions. Status epilepticus. More than 30 minutes of continuous seizure activity. It's life-threatening, fatal. So immediate management for the status epilepsy is necessary. Two or more sequential seizures planning. This period without full recovery between the seizures. There are two or more sequential seizures spanning this period without full recovery between the seizures. It is a medical emergency situation where this is a fair life threatening, so proper care should be maintained. Anti-epileptic drugs. A drug with the decrease the frequency or severity of the seizure in the people with epilepsy. What is the role of anti-epileptic drugs? They basically decreases the frequency, number of the seizures, severity of seizures in the people with epilepsy. Treat the symptoms of seizure, not the underlying epileptic condition. They treat the symptoms of seizure. What is the goal of the anti-epileptic drug? To maximize quality of life by minimizing the seizures and adverse drug effects. Currently, no anti-epileptogenic drugs are available. So, current pharmacology. Under 60% of the people with epilepsy can become seizure free with drug therapy. Like currently, 60% of the people with epilepsy can become seizure with with drug therapy. And another 20% the seizure can be drastically reduced. And 20% elective patient seizures are refractory to currently available anti-epileptic drugs. Choosing anti-epileptic drugs depend upon the seizure type, epilepsy syndrome, pharmacokinetic profile, interaction and other medical conditions, efficacy, expected adverse effects, and cost. These are the some characteristics to choose anti-epileptic drugs. So this is seizure type, epilepsy syndrome, pharmacokinetic properties, interaction with other medical conditions, efficacy, expected adverse effect, and cost. General fact about the anti-epileptic drug, like good oral absorption, you should have a good oral absorption and bioavailability. Most metabolize in liver, but some excreted unchanged in kidneys. Like most of them are metabolized in the liver, some are excreted unchanged in the kidneys. Classical anti-epileptic drugs generally have more severe CNS sedation than the newer drug except ethosuximide. They have more severe CNS sedation because they suppresses the central nervous system than the newer drugs except the ethosuximide. Because of overlapping mechanism of action, best drug can be chosen based on the minimizing the side effect in addition to efficacy. So because of overlapping mechanism of action, best drug can be chosen based on minimizing the side effect in order to in addition to efficacy. So classification of the anti-epileptic drug. Classical classified as a classical like phenytoin, phenobarbital, primidone, carbamazepine, ethosuximide, valproate, valproic acid, trimethadione, not currently used, and new reagents, limotregine, felbamate, topiramate, gabapentin or pregabalin, tiagabine, vagabatrin, so oxycarbazepine, levetiracetam, phosphonatine. Side effects. Uh, there are some side effects associated with these drugs. Like most commonly, sedation is the main issue symptom. Is the side effect of barbiturates. Cosmetic like phenytoin causes nystagmus. Weight gain with the valproic acid and gabapentin. Weight loss with the topiramate. The reproduction function is affected by the valproic acid. Cognitive skills are impaired by the topiramate. Behavior felbamate and levetiracetam affect the behavior expected. And also there are many allergic hypersensitivity reactions are noticed by using these drugs. Cellular mechanism of the seizure generation. Like seizures are seizure generation is because of those certain CNS excitatory release of the neuronal discharge by some release of some cations like sodium, calcium, etc. Like specifically in the case of glutamine. In glutamine, they are the excitatory neurotransmitter cause excitation by the release of sodium and calcium. Here, the similar the case in the most of the case, the diseases are generalized, increased by sodium influx or calcium currents. So the basically we target these like by blocking the sodium channel, by blocking the calcium channels, or indirectly by increasing the calcium influx and potassium efflux. So this also causes the disease, the excitation of the central nervous system. Target for anti-epileptic drugs like increase inhibitory neurotransmitter. So we can target the epileptic patient by increasing inhibitory neurotransmitter to decrease the CNS excitation by enhancing the neurotransmitter system like GABAergic, which is naturally inhibitory neurotransmitter. Decrease excitatory neurotransmitter system like glutamate by blocking the sodium and calcium channels. So block the sodium voltage inward positive current sodium or for calcium. Increase outward positive current potassium increase or potassium efflux also decreases the excitation. Many anti-epileptic drugs pleiotropic act via multiple mechanisms like specifically like sulfuric acid etc. So epilepsy glutamate, the brain major excitatory neurotransmitter. This is the main excited neurotransmitter is glutamate, the brain major excited neurotransmitter. Two group of glutamate receptor, inotropic fast synaptic transmission like NMDA, AMPK kinase. So they are opened by the surrogated voltage gated calcium and the sodium channel. It also have metabotropic slow synaptic transmission, regulation of second messenger by through cyclic AMP and acetyl, so modulation of the synaptic activity. Modulation of the glutamate receptors are glycine, polyamine side, zinc, redox side. Effect of the excited neurotransmitter, like directly sodium channel can open, like these are direct effect, calcium are open, indirect effect, potassium efflux is decreased, and then this is the potassium level, potassium channels are closed, and calcium channels are open. The normal synaptic transmission increase the glutamate bind with the AMDA, AMPA, and kinase receptor. The kinase receptor releasing the sodium and calcium. Glutamate receptor as an anti-epileptic target. NMDA receptor side as a target. Ketamine, phencyclidine, diazepam block the channels and have anti-convulsant properties, but also have dissociative or hallucination properties of like open channel blocking. AMPA receptor side as a target, since it is the workhouse receptor, can anticipate major sedative effect. Felbamate antagonizes the glycine site on the NMDA receptor and blocks the sodium channel. Very potent anti-epileptic drugs lacking sedative effects, unlike nearly all other anti-epileptic drugs. Associated with the rare but fatal aplastic anemia, hence is restricted for use only in extreme refractive epilepsy. Topiramate act on AMPA receptors, blocking the glutamate binding site, but also block the kainate receptor and sodium channel and enhance the GABA currents, highly pleiotropic. So used for partial seizure as an adjunct for absence and clonic seizure, add on alternative to the phenytoin. Very long half-life, 20 hours. GABA is a major inhibitory neurotransmitter in the CNS. Two types, GABA A and GABA A and GABA B. Postsynaptic specific recognition site is the potassium channels. GABA is a presynaptic autoreceptor, also postsynaptically mediated by the potassium current. This is the GABA pentameric structure. These are 5 alpha 2 alpha 2 beta 1 gamma site. So different binding site for the like benzodiazepine binding with the alpha and beta site, alpha and gamma site, and benzobarbiturate bind with the alpha and beta site, and then they open the covalent channels. Thank you so much for listening.